am Community Chloe of Radio One Richmond Stations. What an honor to have you joining us this evening. We're going to talk about when people need help. It's the first of a three-part series. COVID-19 and systematic racism has had a devastating impact in our communities, particularly on Black and Brown communities. Domestic violence, intimate partner violence, substance use, and child abuse all haven risen dramatically. Especially impacted are women and those who identify. You may ask the question, why am I saying when people need help? And the focus is on women. As being the head of households and the caretakers, women carry a heavy load filled with challenges which spills over into the family, the community, so on and so forth. When women struggle, everyone struggles. When people need help, what do? We give it to them. This conversation is designed to be interactive. Please chat your questions and comments as we go along. Please do that. And now I want to introduce our all-star panel. Come on in here, Cass Albert.
Hello, everyone. Good evening. I am Cass Albert of The Helper's Place.
How are you?
I'm doing well. How are you?
I'm good. Cass launched The Helper's Place to bring people together for finding support and encouragement while on their healing journey. Deidre Pearson.
Good evening, Community Chloe.
How are you? Deidre is director of the Women's Substance Use Disorder and Co-occurring Services at Richmond Behavioral Health Authority, known as RBHA. Shanti Wynn, how are you? Come on in.
Hi, how are you, Chloe?
I'm good, Shanti. She's Director of Sexual and Domestic Violence Services at the Richmond YWCA. Shanti, thank you and welcome. Sable Kate Nelson Dyer.
Good evening, Chloe. How are you doing?
I'm doing great, Sable K. COVID-19 Virginia Emergency Support Team, known as VEST, Health Equity and Working Group Chair and Acting Director at the Office of Health Equity with the Virginia Department of Health, known as VDH. Sable K, again, thank you. And last but not least, Ebony Kirkland, come on in.
Good evening, everyone. Thank you so much for having me.
How you doing, Ebony? Ebony is director of the Virginia Anti-Violence Project. So our panel is here. This community conversation is brought to you by the Friends of Prevention Coalition of Richmond. The Friends of Prevention Coalition is comprised of state, local, faith, and community representatives serving as catalysts for promoting wellness to create and sustain safe, healthy, drug-free communities. All right, so it's time to get started. People are being challenged daily by everything happening in our communities. Most recently, we've learned that Black women in the East End are dying from opioid overdoses. Families are struggling to meet basic needs. People are losing their jobs. And young folks attempting to take their lives have increased dramatically. People need help. So I'm going to ask each panelist, starting with you, Cass, give us an overview of your organization.
Yes, so I recently launched The Helper's Place in the spring of this year. And I have the privilege of working in the East End with children and families. And a part of my job is connecting our children, our students, and their families with various community partners. So just from my personal network of resources and things like that, I found that one of the things that has been a help when people are in situations is to have a multifaceted level of support, not just one particular program or organization, but to have a community of care around them. So I had this idea to just have a cool Instagram page, which had started that way. And from there, just connecting with different people, I said, you know what, let me just get a little bit more into it. So I launched a website that I was working on and, having conversations with people. And so my name, Cassandra, actually means helper of mankind. So The Helper's Place is a play on me being a helper, but also someone who advocates for healing as people are on whatever journey they're on, whatever resources they need to promote healing and wholeness, regardless of whatever the station of life is. So that was how I launched The Helper's Place.
Well, thank you so much, Cass, for that. Deidre, come on over here and give us an overview about your organization and the trends that you are seeing in your prospective area.
Well, let me just first say it's my pleasure, my awesome pleasure to be here on this panel with all these fabulous women. I just want to share that I work at the Richmond Behavioral Health Authority. And to put it simply, we're tasked with providing and promoting health, wellness, and recovery. And we're doing it one person, one family, and one community at a time. We provide services to individuals in need of mental health treatment, substance use disorder treatment, individuals who need prevention services, developmental services, and we do it all to individuals in the Richmond City area and others outside of the area through some of our special grants and special projects that we're actually instituting here. We serve as the fiscal agent for several regional programs, and that kind of gives us the opportunity to affect change not only in Richmond, but in other places in the region. And so I have the awesome pleasure of serving the women here at the Behavioral Health Authority, where we empower women to survive, thrive, and to inspire. And I could continue to talk all day. I'm sure you don't want to hear me all day, but I just want to say that I appreciate what you said earlier about women and the struggle, because certainly, our women are in a struggle right now, and I'm so happy that we have this panel of women just targeted to speak to the lives of our women.
Deirdre, thank you so much. Ebony, give us an overview of your organization and the trends that you're seeing in your respective area.
Sure. Virginia Anti-Violence Project works to address and end violence against and within diverse LGBTQ plus communities, especially focusing on Black and Latinx communities. The trends that the organization first works to provide individual advocacy and services for survivors of violence, as well as prevention, education, trainings, community outreach, and community building. And so in that, what we've seen is that LGBTQ plus folks are more likely to have weaker familial ties right now and support systems during the pandemic, that they are subsequently at a higher risk of experiencing domestic violence within families that are quarantined together. They're more likely to be employed at these highly affected industries. They're more exposed. And they're just twice as likely to be victims of violence and exposed to the stressors right now.
Ebony, thank you so much. Now, Sable K.
The Virginia Department of Health has an incredible resource in our Office of Health Equity, where I currently have the honor and privilege of serving as acting director. And within our Office of Health Equity, we have 3 divisions. We have a division of primary care and rural health that seeks to serve individuals in those less densely populated areas here in the Commonwealth. We have a division of social epidemiology, which looks to leverage data so that we can use a data-driven approach to address those disparities that exist here in the Commonwealth. And then finally, we have a division of multicultural health and community engagement, which really seeks to be the bridge between community and state agencies so that we can have a two-way communication in terms of where the unmet needs are, and we can have conversations about how to fill that gap. And it's truly been a Herculean task, but something that's been a humbling experience to try to thread the needle of both serving community as well as understanding the bureaucratic processes that exist here in Virginia. And I also want to let people know that there are resources available to assist women during this time.
That's good. Sable K, thank you so much. Shanti, give us an overview of your organization and the trends that you are seeing in your respective area.
Absolutely. We at the YWC Richmond provide emergency services to survivors of domestic and sexual violence, specifically intimate partner violence, and we provide emergency housing, hospital accompaniment, court advocacy, workforce navigation, case management, counseling services. All those services are free to any survivor who contacts that hotline. Anyone who we're part of a regional hotline that encompasses of 6 other regional agencies in the area who are also providing this important work that I'll be able to jump into a little bit later. But yes, those are the services that we provide. Some of the things that we have seen, of course, when COVID first began, we saw our numbers trend down. And what we realized with domestic and sexual violence is that survivors were not accessing services because of, everyone was in place, and it was harder for survivors to to make those calls or to make those moves. And the hospitals were actually seeing survivors who were, there was, more, egregious injuries or that kind of thing, because people were waiting longer to get support and help. Thankfully, we've seen our numbers start to climb back up, and people are back accessing services, and we are helping funnel services to survivors and make sure that they're getting the support that they need. We're doing it virtually or a hybrid model. It really just depends on with what the needs are, but we've been definitely continuing to do that work.
Shanti, thank you so much. And now it's time for us to start the dialogue. Cass, let me head on back to you. You are here as an advocate for community members. Where do people go to get help?
So that is a very interesting question. So we know that there are so many resources available. Just even the resources that our panelists have shared, there's a wealth of information available. But a lot of times people just don't know where to start. And so as I'm in the community having different conversations with individuals and families, one of the things is just finding out where they are. A lot of times, when people are facing hardships, it's easy for someone to say, well, this is what you need because, you fit into a certain category. My approach has been to have conversations and to build relationships. One of the things that I've been able to do recently is to start support groups, mainly for women, to have other people that are having similar life challenges. It could be someone just needs a book club. Maybe they want to go to a yoga meeting, whatever it is. There are so many things that are available, but it really starts with a conversation and building relationships. And while there are so many agencies that are available, because they're inundated with so many requests and so many people needing assistance, they don't have the capacity right now to just sit down and, build relationships, have coffee with someone. But me, as someone who's in the community, I have the privilege of being able to move and, have different meetings and conversations and being in different spaces to hear what people are actually in need of. And so from there, using my resources, making phone calls, sending emails. I'm big on Google. Listen, you can find any type of group that you want just by searching. But a lot of times when people are in various life circumstances, especially challenging times, they just need someone to come alongside them and to help them to even find language for what they're going through. And I'm a huge advocate for therapy, for mental health, but that's not always the thing that people need. Everyone does not necessarily need to have the therapeutic approach. While that is important, that's not always the thing. Sometimes people just need extra support. Maybe they just need a buddy that they can text with weekly. So that's where I come in, connecting people, whether it's to individuals through support groups, or just people that do have services and saying, hey, there's this awesome program through the YWCA. And I think that's why things like this are so important, so that we know who's doing what in the community, so that we can connect people when they are in need of assistance or support.
Cass, thank you so much for that. And I like what you said, that you have to build these relationships because crisis or a traumatic situation is not a one size fit all. So thank you so much for the comment. Shanti, what is the difference between initiated partner violence and domestic violence? What resources are available and how are they addressed?
Absolutely. So intimate partner violence is abuse or violence between a current or former partner or spouse or dating partner. This type of violence, of course, can be emotional, mental, psychological, physical, sexual. Any of those things can encompass that kind of violence that someone can be experiencing from someone that they're in a relationship with. The domestic violence is more of like that umbrella, right? So domestic violence can be encompasses like family violence. So it can be a child and and a parent or another family member or some sort of mixture of that, or some sort of close relationship. You can categorize categorized there. Also, it can involve pets as well. And so these things when we look at domestic violence, or sexual, it's like that umbrella, and then intimate partner violence and all those things fall under that.
Well, thank you so much for clearing that up for me about the intimate partner. Ebony, can you expand on what Shanti said as it relates to the LGBTQ community?
Yeah, LGBTQ plus people experience domestic violence and intimate partner violence at equal or higher rates to people in heterosexual partnerships. There's also this negative cycle that's made worse by several factors, such as Black women of trans experiencing abuse related to their gender expression, their bodies, pronouns, their overall identity. Outing, when you disclose someone's orientation, is also a common tool of abuse, and other stressors like discrimination, economic suppression. Those other things are also contributing factors to domestic violence and intimate partner violence. They lead to higher rates of substance abuse, which is also another factor of domestic violence and intimate partner violence. And queer people of color are more likely to be incarcerated for things like substance abuse instead of receiving help. So all of that just feeds into the cycle, and all of this comes without access to safe, culturally appropriate resources or help. And so people don't really think that domestic violence and intimate partner violence occur in queer relationships, and when it manifests, they don't know how to either recognize it or respond to it. And so LGBTQ plus victims sometimes are less likely to seek aid due to psychological trauma or prior experiences with bullying or hate crimes, or even experiences with police or state-sanctioned violence.
Ebony, thank you so much for that comment. And we want to make sure all of our viewers just hop into our comment section. If you have any questions or concerns, or if you need follow-ups with any of these ladies, please do. That's what we're having this show right now. Deidre, if someone is watching this evening and has a loved one or need help themselves because they are struggling alone with addiction, what would you say to encourage them to come to RBHA's newly renovated treatment facility or any other place for help and support?
Well, Clavia, let me first say that we are struggling. Women are screaming right now. We are experiencing higher rates of overdose. You mentioned it as we first came on this evening. We're experiencing individuals with increased psychiatric symptoms, increased paranoia, delusions, hallucinations at levels that we haven't seen in a long time. All of these things, of course, are exacerbated by this pandemic. Depressive symptoms that individuals are experiencing. Think about it. You're already struggling with depression, and now you're isolated. And so some of our women and families are really struggling in that way. An increase in different types of drugs in our community. We've seen an increase here in Richmond of the use of meth, which is not something we typically would see in our community. And early on in this pandemic, we saw women who were really concerned about coming in for services. They were concerned about their children. They didn't know what it would be like to come even into a residential facility or to come into treatment services, even on an outpatient basis. Because one thing about us, people of color, if we got to be locked down, we want to be locked down with people we know. We want to be locked down together. And so it was difficult trying to help our women understand that we were here for them, that we understand that it's a struggle for you. So one of the things that we try to communicate to our women, and I think we're doing a good job of it, is letting them know that we are here for you. If you don't hear anything else, we want you to know we are here for you. We're offering that gender responsive, trauma informed care. And those may be big words to some people who are listening to me, but all it's saying is that as a woman, we understand and we're here for you. And we understand that, events in your life have created issues that have made it difficult for you. I've heard someone already talk about addiction and how addiction really makes it difficult to make a decision to change. And although we are very, very proud of the fact that we have a newly renovated women's treatment facility in Highland Park in Richmond, it's a beautiful place. A very welcoming place that our women can come and bring their children, and we're offering fantastic services there. We're offering all types of groups there that focus on the needs of women and how, not just how they're going to get past their addiction, but how they're going to handle this thing called life once they leave our facility and our grounds. We also have a newly renovated Children's Services Center. So we're ready for your children. We're ready for you. We want to assure you that the services that we offer, the case management, individual group therapy, withdrawal management, residential treatment, on and on and on, is just a phone call away. And some people even, whatever the questions are, we're ready to answer them. Some folks say, I need somebody who understands me, who knows where I've been. We have that for you. We have peer support services, individuals with lived experience who are able to speak to your needs. So I just want to encourage you to give it an opportunity. We're trying to break down some of the barriers. When women come in and they say, I can't come because I don't have anybody to watch my children, we say, bring your children. We have a place for them. When women come in and they say, we don't have any transportation, we say, that's okay, we'll come get you. When women come in and say, well, I got to work on trying to get diapers for my baby because they had to sleep in a washcloth last night. Now, some of y'all know what I'm talking about.
Yeah, it's true.
We say, hey, we know where you can get those resources. We have those things for you. So we try to decrease the barriers and try to provide. We actually do a great job in decreasing the barriers and offering the services that women need in order to take a minute and be able to internalize, what is this thing that I'm dealing with right now? This pandemic has really taken people to levels that we've never seen before. I mean, I don't know about you all, but I have my colleagues checking in with me saying, am I all right? Do you think I'm okay? And so if we're doing that for one another, imagine what someone who's trying to figure out how they're going to educate their children, and the teacher is telling me I need to have them in separate spaces, but the separate spaces I have are one in the kitchen, one outside, one in the closet. You guys, you know what I'm talking about here. So our folks are really struggling, but we're here for you.
Wow, Deirdre, thank you so much. And again, ladies, I can't stress to you enough for being here and recognizing that these are problems, these are challenges within our communities. Being a Black woman myself, and for our brown communities, we take on the struggle and we carry too much. And so I think with this conversation, we want people to pop in to the comment section and please reach out to these women. They are ready and willing to help. We're moving into seasonal affective disorder. You're going to have some people that are going to be happy. Some people are going to be sad. Some people are going to commit suicide at this point and OD. And we don't want that to happen because we're letting you know for real, help is here for you. So again, thank you all ladies for being here. Sable K, oftentimes the state is viewed as policymakers and not service providers that directly engages with the community. But we know that is not true. So please tell us what the state is doing in the communities and what opportunities exist for community members to engage more in our state.
Absolutely. And thank you for the question. I think that it's really important for listeners to know that there are individuals within the state government who reflect the lived experiences that they have. Like, I'm a Black woman, I'm a queer person. I have been caught in the destructive and unhealthy cycle of intimate partner violence, both physically and emotionally. And it's because of the kinds of activities that these women on this panel have offered that helped me to break the cycle and to learn what a healthy love relationship looks like. pandemic. And actually today is my 1-year anniversary with my partner. We've been married a year today, and it's because I've learned how to break that cycle and access the services that were available to me at that time. And I wanted to share some of those services here in Virginia that folks could leverage. The first thing that I want to let people to know about is that I'm a millennial, so there's an app for that. One of the things that you all can do is to go to covid.virginia.gov. It will bring you to a website if you're on a computer, or if you are in the App Store, it will allow you to download either on your Apple phone or your Google phone. And if you scroll down to I do not feel safe at home, it links you to a variety of resources that can help to connect folks, whether it's domestic violence issues, if people are concerned about getting resources for their children, also food-related concerns, but just a wide range of services. I just want to make sure that people know that exists there. And specifically for our sisters who are struggling with substance use concerns, I wanted to lift up this number here. It's 1-800-662-HELP. Again, that number is 1-800-662-4357. This will direct you to the Virginia Department of Behavioral Health Services. And you can actually put in your zip code, and they'll let you know what kind of medical assistant treatment, what kind of inpatient or outpatient services are available to help you address your substance use concern. So want you to know that the Virginia Department, like the state agencies, not just the Department of Health, but a variety of state agencies are here with you to support you. And there are people who are passionate about serving community across state government.
Sable K, thank you so much for that, because we are dispelling the myth right now that our state agencies, local, state, and federal, will not assist us. So again, thank you for that. Given all the challenges, what type of adjustments have been made in your organization to address the needs of the community? And I want all of the panelists to respond, starting with you, Cass.
Yeah, well, with the Helpers Place being a new initiative, I'm kind of a blank slate right now, which is an awesome opportunity to connect with organizations such as the RBHA. We are working on some support groups coming up that I'll share in a little while, where we will have opportunities for women to find help and support with their peers. And it's just a great opportunity to really think creatively about how to connect with individuals, especially during this time where, yes, we are starting to see a little bit more in-person interaction, but we're really having to still think about how can we connect with people that do feel isolated when they, just want maybe a hug, a human touch. And so how do we bridge the gap between still being aware of the fact that we are still in a pandemic, and we don't necessarily, we're not able to just go and be and have large group gatherings. So it's really a time to be creative with our connection. And that's one thing that I love, thinking of creative ways outside of the box, ways to connect with people. And maybe it's, just going to a park or something like that. But this is the time now where we have an opportunity to really start thinking about, the way that we used to do things. We hear people saying, oh, I'll be glad when it goes back to normal. There is no more normal. Normal is gone. So we now have an opportunity to do things like this, to really let our community, our friends, our peers, to let them know that we are available. I know being, as practitioners, sometimes you just want to put your helping hat off and just be a person. And that's so important, is building relationships, sending a text message to that friend you haven't, talked to. Hey girl, how you doing? Hey buddy, how you doing? Whatever it is. But we have to be intentional with our connections. And I think that's the thing. Some of the ladies have shared that we're also seeing our peers, ourselves, we're all experiencing this together. But now is the time for us to really find time to think creatively, to really be intentional with connecting, where agencies now have to start connecting with each other, where individual practices, we need to start, it's not just me and mine, it's really us. And I think that's really going to be the thing that helps us to get through this, is knowing that we're not alone. We are not by ourselves. And this is an amazing opportunity to hear, just even from 5 different women, of the awesome things that we're doing in the city. And had it not been for this challenge, we would have never known. I'm certain that we would have never connected. Maybe we would have seen each other in Kroger or something. But this is the time now that we have to be intentional in creating space. And that's the thing. If there is no space, we make the space. If there's no table, we build a table. And so that's what I'm committed to. I'm so thankful for these ladies who are also committed to doing the work, to not just being the practitioners, but also being people and saying like, yes, I'm a human also. I go through things as well. And that's what makes the difference, showing our humanity as well as the practices that we do.
Cass, thank you so much for that comment. We're all joined at the hip now. Ebony, I want to hear from you. What adjustments have you made within your organization due to the issues and challenges right now in our communities?
Yeah, Virginia Anti-Violence Project has always been an organization that meets community members where they are. We aren't unfamiliar with working remotely or creating physical space for our stakeholders' various needs. And so in an effort to still make sure that we're showing up as expected, we've increased our communications with our clients to ensure that they know that we are still working. We've redesigned our website, virginiaavp.org, so that is more user-friendly. It sends a better message about who we are, what our mission is as an organization, and how we work to serve our community. We know that isolation is big for LGBTQ plus survivors. It's big for everyone, even outside of a pandemic. Even more so, our LGBTQ plus youth still need accessible information and resources that aren't dependent upon potentially unsupportive friends or family. So VAVP is still working to further engage LGBTQ plus survivors of violence and other community members through virtual trainings and information sessions. We're building more virtual community space through programs such as community wellness check-ins and mental health support, like our current series titled My Therapist Told Me, A Healing Conversation. The organization looks towards ways to build power and capacity in communities so that the impact of our work reaches far beyond what we were able to do before, especially now that we're relying more on building virtual communities and connections. And so we've even deepened our partnerships with other organizations so that we aren't operating in a silo and that there is communication between partners to make sure that we're still offering comprehensive support to all of our community members.
Ebony, thank you so much for that comment. Shanti, what adjustments have you made over at the Y to take care of the needs of our folks in the community?
Absolutely. Like I stated before, we never stop working as all the other representative agencies on this call. We we had to revamp. And so where we were used to, of course, seeing people face to face and getting items and things to them person to person, we moved to a virtual platform. And also we understood that some of our services couldn't be virtual. So we still had to do some of that face-to-face, and so we work to do that safely with our staff and also with other people who are working with us to make sure that any services that we are providing, that they are safe. And so what we found is, a lot of times with our survivors, it sometimes will be hard to do some of the face-to-face depending on what was happening, or if it's childcare or different things of that nature. And so the virtual platform has really been instrumental and really helpful to really helping support a lot of survivors, more so than we thought. And as Cass said earlier, like this, going back to the old way, like we're looking at ways that we can continue this as we move along, where people will have these options to be able to do things virtually and in person, when needed, whatever's going to work for their plan and what is best for them. And so being able to offer all of our services in that capacity has been really, really helpful. And just the team themselves being creative about how to get important things to survivors. For instance, in our workforce department, someone needed a desk. And of course, it would have normally been, you come on downtown and we'll get that desk to you. But that couldn't happen in COVID. And so what needed to happen was that desk needed to be we was able to purchase that desk and actually get it mailed to that survivor's home, so that she then would be in a place where she could work remotely and continue to provide for her family. And so the team is just creative in thinking outside of the box or outside of the box or different ways to make sure that we're still connecting survivors. Our hotline operates 24/7, 365. And we have, again, like I talked before earlier about the regional hotline, that number, anyone can call that number and we will direct them to the respective locality where they can receive support and services. And so we continue to really try to make sure that survivors are getting the
all of
support
the numbers
that
that we have, say Bouquet gave a number, just put those numbers in the comment section. Yeah. So
absolutely. And just to say that number is 804-612-6126. And anyone can contact that number and be directed. You'll reach a person who will talk with you to figure out what your needs are and get you to the correct locality that will assist you and help you with anything.
Okay. What adjustments have you made to help the needs in the community?
I think that the most emerging way is we have been very intentional in the way that we have been engaging with community, making sure that we are having collaborative conversations, not speaking at, but having conversations where we're not speaking and listening just to respond, but listening to actually hear what community is saying. It's helped to shape several of the COVID-related programs that we have, but also to create some new programs. So one of the pieces that I wanted to highlight here is our Wellness Wednesdays. Every week since July, or actually since May, we've been having meditation and yoga sessions. And I can certainly drop the Zoom link. We're having another one tomorrow, and we have several other ones coming up for the rest of the year. But it's just an opportunity for us to center ourselves. These are such stressful times, and it gives people an opportunity to refresh, to re-engage, and to center, to make sure that we can serve the families and our partners and our working community. And the other piece that I wanted to kind of give you all a preview of is the Virginia Department of Health Office of Health Equity is actually going to be having a resiliency series in December. As was mentioned earlier, we know seasonal affective disorder is coming up upon us, and compounded with everything that's happening in this COVID-19 moment. We are partnering with several different statewide agencies to give people, not just talk about the issue in a theoretical sense, but to give people practical tools. If I am having substance use concerns and I'm thinking about relapsing, where do I go? If I'm having mental health concerns, what do I do? If I'm feeling disconnected from my family because I can't go to my aunt's house, my grandmother's house, whoever for the holidays to celebrate with them, or they're not here because of the virus, how do you cope with that loss and that grief? So I encourage you all to follow the Virginia Department of Health Office of Health Equity on Instagram and on social media, Twitter, Facebook, and you'll see those flyers circulating there for our resiliency sessions there.
Say Bouquet, thank you. And Deirdre, last but not least, what are some of the adjustments that has been made at RBHA to still support the needs of the community?
Well, Chloe, as you know, just as you've heard from a lot of the other agencies, we are 365, 24/7. And we never stopped. We continue to provide services in the community. One of the things that I heard, I believe it was Cass that said earlier, she talked about connections. And so one of the things that we tasked ourselves with doing is trying to figure out how we would continue to help people make connections, even in a pandemic. How do you make connections and connect individuals with the things that they need, even during a time like this? And so, although I think it was Sable say she's a millennial, I'm not, but I had to become real familiar with some of these devices here. And so one of the first things we did is create a task force at the RBHA. So we have a COVID-19 task force, and that task force looked at every area of the agency to see how do we provide services in the safest way possible, in the most expedient way possible, and continue to provide services at the level at which the community is used to receiving them from us. And so we've done a fantastic job, an excellent job. We were one of the first agencies that got on top of this and went ahead and try to create some pathways for people. So we're doing everything virtual. We are doing groups virtually, individual therapy virtually. We are also, of course, continuing to operate a warm line. So we have 24/7 services for people. We have crisis intervention services that are still happening. All someone has to do is pick up the telephone or go to our website, www.rbha.org, and you can connect with someone. Connections are so important. On our campus, we looked at the milieu and tried to figure out what would be the safest way to continue to allow people to come into treatment. So we decreased our census so that we could have individuals in rooms alone, so that they would feel safe and not be concerned about infecting one another. We have all types of COVID-19 precautions that we're taking on the campus, but continuing to accept referrals. And I must let you know they have increased by tenfold at this point during this pandemic. But just continuing just to make connections with people in our community. We've made some major adjustments so that folks will know that we're still here for you.
All right. When the community needs help, ladies, we give it to them. What are some practical advice to our viewers right now? I mean, right now, if folks want more information, how can they call or contact you? Let's start with you, Sable K.
Thank you so much. The first thing I would encourage you all to do is to email the Office of Health Equity at ohe@vdh.virginia.gov, and I'll definitely say that, but it's ohe@vdh.virginia.gov. That's the best way to stay connected. Follow us on the different social media platforms to be connected to our resource sessions, but also, like, real talk, want to make sure that people take care of themselves. Like, self-care is so important in this moment. I'm an avid tea drinker, and one of the things that my grandmother used to say, like, you can't pour from an empty cup. So as Black women, we are the bedrocks of our community, of our households, of our workplaces. And if we are spent, we don't have anything to give. So I would certainly encourage us to engage in self-care, whatever that looks like for you, so that you can make sure that before you give, because we're always going to give, we're always going to support, but make sure that we're taking care of ourselves as well. And also wanting to make sure that we celebrate our amazing teams. There are some incredible women who are on the phone today. I know that my work doesn't exist in a vacuum, so just know that there are so many people working behind the scenes to make sure that your lives are the best that they could be in this moment. And I just want to lift up my partners at the Virginia Department of Emergency Management, and Curtis Brown, the state coordinator, and Dr. Janice Underwood in the governor's office. She's our Commonwealth Director of Diversity, Equity, and Inclusion. It truly takes a collective impact effort to positively impact women, female identified persons across the Commonwealth.
All right. Thank you so much for that. And I'm going to move on to this. We're going to respond back. Are your organizations equipped to serve Spanish-speaking communities? Cass, you can respond. Oh, you want to start with you, Sable K? Sure.
Absolutely. One of the things we have, one of the programs that we have is culturally and linguistically appropriate services within the Office of Health Equity. We've actually hired someone to assist with improving our translation services. We have been very adamant making sure that there is Spanish language translation, Spanish language captioning to the extent that that's possible, and also making sure that the messaging from the Virginia Department of Health that is developed isn't just translated from English into Spanish, but it also takes into account those cultural components, because sometimes things that are linguistically translated correctly don't translate culturally in the same way, and making sure that we have those components as well. So that's been a hallmark of our response over the past few weeks and months, to make sure that we have that cultural humility approach to our messaging.
Sable K, thank you. Ebony, what about your organization? Is it equipped with services for the Spanish-speaking community?
Absolutely. As an organization, VAVP has a public commitment to language access and justice. We also know that language is more than spoken words and encompasses a variety of ways that people communicate and comprehend. So we have bilingual materials, including our website, for clients and community members to engage with. We have access to a language line. We partner with organizations with strong ties to the Latinx community, and we also have a Latinx community advocate on staff and a pool of interpreters for our programs and events.
All right, Cass.
Yeah, so again, as the Helpers Place is growing, we do not currently have someone that, can translate or bilingual. But one thing that I guess the years of Spanish in, middle school and high school, so I am able to speak conversational Spanish, at least to have an initial conversation. But again, this is why it's so important to be connected and to know where the resources are.
Mm-hmm.
So even as I'm considering growing and expanding my organization, yes, having those that, can speak Spanish to reach out to our Latinx community.
Thank you, Cass. Shanti, does your organization, are you equipped with Spanish speaking to support the Spanish speaking community, that is?
Absolutely. Similar to what Ebony discussed, we have our website translated into Spanish. We also have bilingual materials, for survivors to access. We have the ability to have survivors text in various languages, depending on what their language is. It could be Spanish, but it could also be other languages as well, where we're able to communicate with survivors as well. We access the language line. We have partnerships with other organizations in the community, our partner organizations, Safe Harbor, Hanover Safe Place, the James House, Thrive Virginia, Goochland Cares, all of those agencies that are also able to help support survivors who are bilingual or speak different languages.
Okay. Same question for you, Deirdre, over at RBHA.
Well, yes, absolutely. We employ bilingual staff, and we have materials that are translated. We have information on our website. We have access to translation lines wherein we serve individuals that are not just Spanish speaking, but have other language barriers as well. And we ensure that we have initiatives in the community so that we can reach the Spanish speaking community as well. Yes.
All right. Deirdre, thank you so much. Now I'm going to head back to that question about the community needs and what practical advices do you have for our viewers and how can they get in contact with you? And I want to go back to you, Cass. Can you respond?
Yeah, so I was talking with one of my mentors who is from the RBHA, Charlene Edwards, and we were talking this morning, and she mentioned the song by Alicia Keys, Superwoman, and, she talks about, I put the S on my chest, and I think a lot of times as women, we put our cape on every single day, sometimes whether we want to or not, and Charlene and I were talking about how sometimes, yes, the S can mean more than just being a superwoman. It could mean support. It could mean sympathy. It could mean services. It could mean stillness. We have to begin to practice stillness and rest. And the illustration that I love to use is like when you're on an airplane, they give you these instructions that you put your mask on first. And I remember hearing that and I'm like, oh my goodness, but if I'm with my kids, then, how I need to help them. But I'm realizing if I can't breathe, if I'm lacking oxygen, how can I help anyone else? And that has been something that has stayed with me. There have been times when I've had to look within my own life where, like you said, Sable, you're pouring out of an empty cup and you are spent. But we have to, as women, as people, we have to find time and make time, not just find time. We have to make time. Maybe it's 5 minutes here and there just to say, you know what, I'm not going to do anything right now. And to free ourselves from that guilt of feeling like we have to do something all the time. We have to give ourselves grace. We have to give ourselves space. And we have to give ourselves permission to be fully human. And being fully human means embracing every part of ourselves. That means crying sometimes. If we have kids, that means saying, listen, I can't mom right now. Okay, give me a few minutes. Whatever it is, we are caretakers. We are helpers. We are doing so much work, but we have to take care of ourselves. And whatever that is, it's going to look different for different people, but we have to make the time. I can't even say find time because when you're trying to find something, it's like it's lost and you're scrambling, but we have to make time and be intentional about creating space for ourselves before we pour out to anybody else. And so, yes, I am somebody who is on a journey as well. I would love to connect. I just launched a website. It is thehelpersplace.com. I can also be reached via email, helpersplace@gmail.com. I am not a service provider, but I am someone who is in the community, who connects with resources and agencies. And for those of you who are a part of agencies, maybe there's a support group that you would like to get started and you don't have the time. Listen, reach out to me, thehelpersplace.com or helpersplace@gmail.com. I would love to come in and help to leverage, like maybe you just don't have the time or the energy to lead a support group. Reach out to me. I am here. Community members, yes, I'm here to have a conversation. And that's a part of my tagline. It all starts with a conversation, building relationships and being intentional about connecting with people.
Cass, and thank you so much for all of your comments. You know what I'm going to do when I go home today with my 13-year-old? I can't mom you for 5 minutes.
That's it. I can't mom today.
I needed that too. Say okay.
Yes.
I mean, I'm just pouring out cups that I don't even have. So let's go on over to you, Ebony. What advice, practical advice that you have for our viewers, and how can they contact you?
Yeah, the first piece of advice I can give right now is to reach out. If there is something that you need, there is someone in community who can connect you to an organization or a person doing the work. So find community. If you are an LGBTQ plus transgender or gender nonconforming person, you're a survivor of violence, especially if you are Black or Latinx, if you need emergency housing, transportation, your basic needs met, emotional support, help navigating systems, intervention assistance, translation and interpretation, reach out to VAVP at info@virginiaavp.org or VAVP Advocacy and Services at virginiaavp.org. If you are in need of food pantry items or free STI and HIV testing, reach out to Nations Foundation. They are Nations Foundation, RVA.org, and that's Nations with a Z. Trans Family and Friends, there are programs specifically for you at Nations Foundation. There's supports there for you. Peter's Place is a new community organization that focuses specifically on the intersection of LGBTQ plus identity, substance abuse, and Black, Indigenous, and other people of color identities. Queer people of color seeking assistance for abuse recovery support are often, like I said before, criminalized before they get the help that they need. So that particular organization was founded because there weren't any culturally specific organizations in that way. So you can contact them at petersplacerva.org. And if you are an LGBTQ plus youth or young adult needing resources, especially around injustices in the school system or at home, please reach out to Side by Side at sidebyside.va.org.
Ebony, thank you so much. And Deidre, for you, some practical advice for our viewers, and who should we contact for more information?
Well, the first thing I would say is don't be afraid to lift your hand and ask for help. Don't be afraid to do that. One of the things that I think about often is that we've got to continue to maintain connections with one another. And so we talk about building a village. One of the things that we've been sharing with individuals is that sometimes your village in a situation like this, in a pandemic, in a time where we're dealing with all types of racial injustice, in a time where we're dealing with all types of election news, sometimes that village is going to look differently. Sometimes you're going to have to reach out to someone else to help build your village. But I say maintain that connection and don't be afraid to ask for help. I was listening to Cass earlier, and I know Charlene, and I like songs too. And one of the songs I thought about was, and I thought of this morning, how we used to talk about I'm strong, I'm invincible, I am woman. Well,
Yeah.
I thought about paper dolls. And sometimes, if you can recall, the paper dolls had this little flap on the back, wherein in order to stand up, you had to kind of situate that flap in the back. So
Right.
sometimes being strong and invincible means somebody may have their hand in your back. So I just encourage you, don't be afraid to reach out to somebody to put their hand in your back. It doesn't mean that you're not strong. It doesn't mean you're not invincible. Doesn't mean you're not a woman. Doesn't mean you're not everything you need to be. But sometimes you need something and somebody to put their hand in your back. So I just say you can reach out to us. Our number is 804-819-4000. Very simple to remember. You can reach someone 24 hours a day at that number. Our website is www.rbha.org. You can even chat on our website directly to different departments if you are interested in speaking with someone directly. Or you can go on that website and you can find my number, and I promise I'll answer your call. Thank you.
Thank you, all ladies, for being here. What a wonderful show today, to be about us and to help empower us and have that little flap to hold us up in the back. And also, sometimes you have to raise your hand, and then sometimes you just have to surrender. And just have to surrender all. For the longest time down through the ages, we have always been the no crying woman, the strong woman, working through her pain, raging through the storm, and still being everything for everybody else. And so when you get in that pit and you're at your lowest, just know that we're here to help you. And we also have agencies here to help you as well. And some of the takeaways from me, listen to hear and not respond. That is very important, because if you're waiting to respond, you're not listening. And then building a relationship, because some person in a crisis situation is not a one size fit all. What may be a crisis to you or me may not be a crisis to someone else. Some people can overcome situations. Some people will commit suicide for that situation that we can walk away from. And so I'm just so honored to have you here, Cass Albert with the Helpers Place. Thank you so much for being here.
Thank you.
Deirdre Pearson, Director, Women's Substance Use Disorder and Co-occurring Services at Richmond Behavioral Health Authority, known as RBHA. Shanti Wynn, Director of Sexual and Domestic Violence Services at Richmond YWCA. Sable K. Nelson Dyer with the Virginia Emergency Support Vets Team with COVID-19, and Health Equity Working Group Chair and Acting Director with the Office of Health Equity with the Virginia Department of Health, known as VDH. Ebony Kirkland, Director of the Virginia Anti-Violence Project. Thank you so much for being here. And for all of our viewers this evening, as you're watching, just hop into our comment section and say, Chloe, I want us to cover this topic in a community conversation as well. And we want to thank you once again for watching, and reach out. We have all of the information in our comment section, so utilize this conversation, because it's going to be on our Facebook pages and it's never going to leave. So you want to go back and watch it again. If it's something that you thought you heard and you didn't hear, just go back and you can watch it over and over again. So thank you so much for watching on our KISS FM's Facebook page, and God bless you.